Okay, so I've been asked to speak about sexual assault and genital injuries, and what's the evidence that we've got. Just declaration of interest, none. I just thought we're talking about genital injuries, but I think in sexual assault cases, you quite often might find injuries or expect to find injuries elsewhere on the body. So I thought the first thing we ought to do, I didn't want you to inflict genital injuries on yourself, but I just wondered whether you'd be interested in taking part in a bit of evidence, because there's a cash prize at the end that Ian's going to pay. So if you could just roll up your sleeves and just bite your arm as hard as you can for a second or two. There is a method, there's a logic for me asking you to do this. And then it depends on how friendly you are with the person you sat next to. You can either grab their arm, or you could grab the top of your own arm and really squeeze as tight as possible the top of your arm for a few seconds. Again, there's another cash prize associated with this, and we'll come back to that in a minute. But in terms of doing a genital examination for a sexual assault, there's two reasons why we want to do that. One is therapeutic, so are there any injuries that need attending to? They might want reassurance they're okay. You might be interested in pregnancy or screening for STIs. But in terms of the forensic part, we might be looking for the presence or absence of injuries, documenting them, collecting evidence. So that it's twofold why we might be doing that. And if you're examining someone where there's an allegation of sexual assault, what you're acting as is an independent observer for a court later on. And so a court might have several questions that they want answers to. So you're trying to collect the evidence that might help somebody answer, hopefully in an evidence-based way. Could this assault actually have happened? What the child or the person is telling us, is it physically possible for these acts to have happened? When did it happen? Because that might implicate certain parties, if you can answer that question. How did it happen? Who did it? Who is it that's assaulted this child or this person? And where did it happen? So we're trying to get evidence for this. And that's very difficult. And I think in terms of evidence base, it's really important that the most important tool is our brain. So when you're doing these examinations, you've really got to engage your brain and not base it on anything else, in terms of how can we help a jury, if it even gets as far as a jury later on. So what is the evidence base? Well, for sexual assault, on the whole, I think it's very poor. And there's a whole host of reasons for that. It's actually incredibly difficult to do some of these studies. I'll show you details of a study later on that it took us a long time to get it past the ethics committee. And you can imagine, can't you? Say if you were a class of 10-year-olds, it's not like we'll give you antibiotic A, that side of the room, and you antibiotic B. You know, I can't come into a classroom and say, you children, you're going to play in the playground for 10 minutes, and we're going to put you in a room with a paedophile for 10 minutes, and then we'll compare findings. You know, you won't get that past the PTA, let alone the ethics committee, so it's difficult to do that. One of the things is very poor description of anatomy. Particularly genital anatomy. Are there any of you here who do this kind of work or do sexual health? Okay, so I'd expect that you would be quite good on genital anatomy, but I bet the rest of you are probably fairly poor at describing the anatomy. Very poor at descriptions. So what do you mean by an abrasion? What do you mean by a laceration? And certainly when you're reviewing papers, there's a massive overlap between how people describe things. So if you're trying to pull evidence from papers, what do they actually mean? A lot of papers will mix ages as well. So they'll include prepubertal, postpubertal. And then the other thing is, very difficult to get a good history from complainants, victims. And that's for a whole host of reasons. If I asked you here today, Do we have a volunteer to come to the front and just tell us when you last had sex? You know, have we got any volunteers to answer a few questions on that? You're all going a bit shy, aren't you? So it's quite difficult to get a good history from complainants' victims about what has actually happened, because they might be embarrassed to tell you, or some of them, particularly the children, might not have the vocabulary. They might not actually understand what happened to them. We need to know the history. So what is the allegation? And in terms of evidence, and you see, we would, as the examiner, find the findings from the examination, and we might come up with an opinion. And what's our opinion based on? Hopefully a little bit of evidence. That might go through to the police, to Crown Prosecution, and then members of the jury. And the people have a lot of myths and stereotypes about what might happen giving any assaults. So depending on the nature of the allegation, if it's been sexual touching, you're not expecting to find an injury, or you shouldn't be expecting to find an injury. But that changes a lot. I remember being on call and seeing a couple of people through the night who'd made allegations of rape. And the next day, a police officer phoned me up and said, "Dr. White, you haven't included any body charts for the injuries from the case that you saw. So I'm very sorry, you know. Just run through with me what I wrote, and then I'll try and help you out." And this woman that I'd seen, I hadn't noted any injuries, genital injuries. And the police woman was saying, "But you've not given me any body charts." I said, "Well, I'm not sure I'm understanding you. Why would there be body charts of injuries if I didn't find any?" And she said, "Well, even if she's had consensual sex, you always get injuries, don't you, even after consensual sex?" And I had to say, "Well, you know, I think you need to change your boyfriend, because that's not normal." And what was worrying is she'll be making a decision about whether to go to CPS, whether to progress with that case, based on her experience of what's normal having sex. Time since the alleged assault, so injuries heal very quickly, even if you examine women who've just had children. You know, and sometimes it looks like a bomb's gone off sometimes, doesn't it, when you see somebody just after they've delivered a baby. And yet, weeks later, there can be no sign of that. And so if in sexual assault, even you might get, say, a tiny laceration, abrasion, that will heal very, very quickly, within days. So if there's a delay examining, you're not going to see anything abnormal. Age, hormonal status, so if a big difference if you're examining a 6-year-old as opposed to, say, a sexually active 26-year-old. And these are the things, you know, previous sexual intercourse in the last 10 days, medical history, surgical history. These are all going to impact on what you may be expecting to find. Just I won't run over the anatomy, but that's the kind of thing you need to know. Examination techniques. So quite commonly, you might, sorry for showing you pictures like this, but you might examine somebody and you can't really see much what's going on. But different examination techniques, you can see that there's a notch here, which you wouldn't see because of the fimbriated nature of what you're looking at there. So you need to make sure that you're examining correctly. Just because you've got a photograph of something, a 2D object, doesn't necessarily mean you've got proof. And of course, this can affect your interpretation and the evidence of what you see. If you do find anything, could it be accidental? So again, during the examination, you need to be thinking, well, a common scenario would be the toddler who arrives in hospital with genital bleeding and injuries. And it might be a history of they're climbing out of the bath and they slip, so a straddle injury. Does this fit in? What is the evidence? How many straddle injuries, people climbing out of baths, have we examined? And what is the evidence? What would you actually expect to see? Is it an anatomical variation? Is it a manifestation of a disease process? Is it Crohn's disease? Is it something unusual? This, I have to point out, these aren't real hymen, but again, thinking of the age, so the prepubertal, it's more rigid, and postpubertal estrogen kicks in, so it's more stretchy. So again, what is the evidence for the different age groups? The evidence, I say, was very poor, and trying to address that. So in March 2008, this book was published, and basically, there's a whole group of us went through thousands and thousands of papers trying to, what is the evidence, what can we get from these papers, so that if you find a finding, what does this actually mean? And the interesting thing is that this book debunked a lot of beliefs from prior to this, and I know I'm currently involved in two reports where cases are going to the Court of Appeal because people have been sent to prison based on what people felt was the evidence beforehand that is now being overturned. So it's got huge implications, very different from the usual medical evidence. People go to prison on what we say, or they don't go to prison when they should do, based on what we say. So it's got to be a lot more than do I give antibiotic A or B when we're giving our evidence. Just going on quickly, have we got any lawyers in the room? People going to own up to being lawyers seem to have very strange sex lives, lawyers. If I'm in the witness box and I've examined somebody who says they've been raped and I find an injury, the lawyers will always say, or the defence lawyers, well, it's just rough consensual sex. They seem to engage in a lot of rough consensual sex. So we were interested in what does happen with consensual sex. So we looked at 500 women who'd made a complaint of rape, and of course we can't prove it was true, but we're looking at what were the injury rates there. And then we looked at a control group, so women who'd had consensual sex within 48 hours of an examination, and how often did we find injuries in that group. And the 500 women, so those who'd complained of non-consensual sex, the injury rate was just under a quarter. And a lot of these injuries were very minor, bruises, abrasions. What do you think it was for the consensual group? No, less. It was about 6%. Okay, but none of the women knew that they had, none of the consensual group knew that they had injuries. We're talking about tiny, sort of couple of millimetre abrasions or bruises, lacerations, so very tiny. So the big thing to me was this part, that the vast majority, so 500 women, of course there's going to be false allegations within that, but you know, even the most ardent Daily Mail reader will acknowledge that some might be telling the truth. So the vast majority, there's no injury there. And then I was looking at the adolescents, so the young girls who said that they've been raped and they've never had sex beforehand, frequently will be asked, can we tell if they're still a virgin? Could this have happened? Couldn't it have happened? And so we did, we looked at this. And the girls who said they'd been raped but never had sex before, 62% had a genital injury. Again, the vast majority of these injuries would be bruises, abrasions that would go without leaving a trace later on. So first-time intercourse does not have to result in any injury, okay? Even if the sex is non-consensual. Most of these injuries will heal rapidly, usually completely. And this was an interesting paper by Nancy Kellogg, and she looked at 36 pregnant adolescents who'd made an allegation of non-consensual sex. They're pregnant, they're not all called Mary, so whether it's true or not true about the consensual part, something's happened. And 34 out of 36 had an intact hymen. So this concept of virginity, whether you can test for virginity, is a fallacy. And this, I got this off the internet. This is from March this year. In the Arab Spring, there were stories of demonstrators being tested I'm not quite sure of the logic why, but tested to see if they were still virgins. And certain other countries, if you apply for a job as a teacher, if you're an unmarried woman, you apply for a job as a teacher or a policewoman, you'll have to undergo a virginity test. They used to do that in this country until not so long ago. If you were emigrating into this country as a fiancé status, you had to have a virginity test, and the evidence isn't there, it's rubbish. So it's normal to be normal after making sexual assault, particularly for the children. Why? Could be because you made it all up and it didn't happen, or it happened but it didn't cause an injury, or the injury has since healed, or the honest mistake. We get this with children. Young children. I'm from Manchester, but even in Manchester the vast majority of young children are not sexually active. So he put his willy inside me, but what does inside mean? And it could just be the penis sort of pressing against the genitalia, so the child's honestly making a mistake. We need to remember the male victims. It's unusual for them to have genital injuries, may have anal injuries. Our experience are more likely to have body injuries. Again, of course, it depends when you examine them. So we can't be judge and jury. It's very important, and it's important that we try to get the evidence across to members of the jury, because it's not us who will make that decision. We've done a lot of work with them. So we helped with Coronation Street recently. They did a story on rape. Hollyoaks, anyone admitting to watching Hollyoaks? But again, because in the media, rape victims should be black and blue, otherwise it didn't happen. And this, it wasn't just to wake you up, but has anybody got teeth marks on their arms? Any of you who bit yourself? It'd be interesting if you waited, say, till the evening or tomorrow, whether you've got a bruise. And the reason I do this is I do a lot of talking to the judges and the lawyers, and quite frequently if you see a young child with bite marks, the defence might be, well, we were just playing. So the adult mind in the child was just playing. And it'd be interesting, it's painful, and it'd be interesting to see if any of you've got bruises, because you actually have to bite yourself very hard. So I know that's not really good evidence, but it's quite good to make the judges bite themselves and inflict a bit of pain. And the other thing is bruising at the top of the arm. So you give a history of, he grabbed me, he dragged me down the street, and there's no injury on the arm. What does that mean? They made it up. They were wearing a thick jacket. Be interesting to see if any of you have got bruises at the top of your arm. And if you have, if you get back in touch with Ian, there will be a cash prize. So thank you very much.
Hi, I'm Sarah. I'm a fourth-year medical student at King's College London. I was just wondering, the virginity testing that you mentioned, what does that examination include? Is it the intact hymen that you're looking for, and how accurate?
Well, that's what I'm saying. We wouldn't do that. Yeah, and if I hear the phrase intact, what does that mean? We know that, as I said before, you can have sex, whether it's with or without consent, and still have the intact hymen, but you can equally have what looks like to be damage to the hymen, and it doesn't mean that you've had sex. So it's not useful at all. And I'm not sure what... Well, I've seen pictures on the internet. In fact, you get some quite strange pictures if you Google that one. But women all lined up and, people peering down at the nether regions to see whether they're virgins or not. And we know these days that you can actually be made back into a virgin, can't you, if you pay enough money to a private gynaecologist.
Okay, thanks.
Rachel Walker, GP trainee. I'm just wondering, in your experience, for the victims that don't actually have any physical harm, what kind of proportion of cases go on where the perpetrator actually gets convicted?
Okay, it can happen. Clearly, if they've got lots of injuries, it's going to help their case, because otherwise it depends on the nature of the allegation and who's involved, whether it's, you know, their case against one person against another. Because to be fair to the jury, it's a big decision, isn't it? And you don't want to send someone to prison who doesn't deserve to go to prison, and it's beyond reasonable doubt. But it certainly can happen, and it will depend a lot, I think, on the person in terms of them giving evidence. The big thing that we're trying to do is make sure that the people making the decision whether this should go even to court know what the evidence is there. So the decision makers, whether that's the doctor themselves when they're writing reports, you know, that they are robust in their opinion, this neither confirms nor refutes the allegation. And then the police, the CPS, so there's all these hurdles that need to be jumped. So it's making sure they're making the decision on the right evidence. That's the crucial thing. And then making sure that a jury, if it is neutral, that they do understand that the medical evidence is neutral. And then it will go on the veracity or otherwise of the different parties involved. Do you see what I mean?